Saskatoon's Royal University Hospital is a familiar sight to anyone who's been there, but can you imagine having a doctor interview you about your medical concerns outside the front doors? That's actually happened this week. Dr. Joanna Smith tweeted that the emergency room was full. Now, her colleague Dr. Paul Olszynski is speaking out. He says that's just the tip of the iceberg.
But what we are seeing right now is kind of this multifactorial crisis where we have not only the everyday demands as people have kind of gone back to living their everyday lives, but we also have the fallout from the pandemic, which includes burnout and people just unable to pick up shifts, take on more shifts, and in some cases, people pulling back a little bit because they don't feel like they're working in a safe environment or don't think they can provide the care that they think they should be able to.
Olszynski says the ER at St. Paul's Hospital is currently short 6 nurses, for example. He's worried that if staff continue to operate at the high state of vigilance they're being forced to maintain, someone will crash and make a mistake.
And so as you start to go numb, you start to worry that you're going to miss things. And I think it's the final sign of actually the commitment that many of us have to our patients where we say, I'm starting to be numb. I'm going to miss something, and that for the safety of patients, I need to step back. And I think that's what you're seeing.
Making matters worse, according to Olszynski, is that the Saskatchewan government has remained silent about what's going on.
I think what makes burnout worse is a feeling of being abandoned or not supported. And I do feel like the crisis in our emergency departments is being downplayed. And that's tough. That's frustrating because we are struggling.
Olszynski's advice to the province and to the public is simple and something people have heard many times over the pandemic. Wear a mask in crowded spaces, and if you haven't already, get vaccinated. That, he says, will help stem the high flow of patients that's causing so much pressure for already beleaguered healthcare workers. Guy Kemville, CBC News, Saskatoon.